those results go right lockstep with what the Pew study found, that if we feel less lonely and if we know we are more socially connected, our overall health will improve.
According to a new survey by the Pew Research Center, equal shares of U.S. men and women say they're lonely. The survey, Men, Women, and Social Connections, also found that women are more likely to reach out to a wider network for emotional support. On today's Sound Living, the importance of connections. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. Elaine Johannes, the Kansas Health Foundation's Distinguished Professor of Community Health at Kansas State University, says 16% of those surveyed reported feeling lonely or isolated from those around them all or most of the time, and 38% said they sometimes feel lonely.
Jeff, it was, I would say 2023, that as a society we started to understand what the pandemic led to when we became socially isolated, and we felt the loneliness of being isolated. And then the Surgeon General at that time released a really excellent report on the epidemic of social isolation and what's going on and how does it affect our long-term health. Well, this most recent report from the Pew Research Center teases that apart a little bit more, and it allows us to understand that there are differences between social isolation and loneliness, which is an emotion. But both of those issues do reveal some differences in how we as women or as men seek out social connections. And how does that affect our overall health?
Yeah, so like 1 in 6 Americans say they feel lonely or isolated from those around them, and that's either all or most of the time.
Yes, and that's where really some problematic health outcomes stem from. That if a good number of us feel apart from our community, apart from a group, even, apart from our species, humans, we have some health outcomes that aren't good. For example, our overall inflammation across our systems, our body systems goes up. So we have more tendency to have some maybe health outcomes like hypertension. Some of those stress hormones get into our system, and those are hard to deal with, like creosote. The other thing is that our psychology, we don't feel connected. We feel maybe more uneasy in the places we go. We don't know people. So as a species, we have survived by looking at the environment around us and knowing how to kind of adapt to it. Well, goodness, if we aren't connected, we aren't around others, our behaviors may actually change too, as well as our thinking. And then, of course, if we don't feel like we're part of a community, then in our behavior, we may be less physically active. We may not go to a sports team or a game or go to a faith community meeting or a town hall forum about, a new street in our neighborhood. We may not even go physically to a grocery store anymore. We may just purchase things online and delivered. So it's a cascade of things that if we honestly start noticing our behavior and we start noticing that we're not as healthy as we once were, maybe it has to do with our social isolation.
One of the things that jumped out at me was the fact that there was a difference based on age, and surprisingly, it was the younger demographic that was more impacted by loneliness than the older demographic.
Yes, I was surprised at that too. The report, first off, leads us to understand that there are different ways that women do seek out social support. Those can be with our spouses, our partners, our friends, our moms, even our co-workers. For men still seek out those kinds of resources of support, but they tend to not, just rely on their moms. It's their partners and maybe a best friend. After we looked at that part of the report, then you're right. We looked at, okay, but let's look at, is this age specific or is there some age? You're right. Under the age of 50, the respondents, and this is a national study, it's very reputable, under age 50, the responses are that people not only are socially isolated, meaning observably they aren't around a lot of people, But then the feeling of loneliness for under age 50. Also, the people that have less education, maybe, according to the study, are feeling more lonely. And then also those are low income. And then people that don't have a partner, don't have a spouse, don't have that one individual that they might go home to. Or maybe they don't go home. Maybe they're working remote and they're working in their own apartment and they really have no opportunity to find a partner, a soulmate, a person that they rely on in their lives. So under age 50, you're absolutely right, have more risk of even a briefer lifespan. That's the other thing about this report and some other reports that came out in 2024 and that are continuing to come out, that those that are socially isolated have a 32% increase in earlier death. Those that are lonely, 14%. My goodness, if you are so socially isolated and then you're lonely about it, no wonder our lifespans here in the United States seem to be shorter than they once were.
The over 65 age group said that they didn't feel like they were all that lonely. This survey didn't really get into the whys of what people were reporting, but what would you maybe think might be one of the contributing factors? Do they belong to organizations? Are they part of a church group? What's happening to where they're not feeling that isolation?
Yes. I do believe that those of us that were raised earlier, that are over the age of 50 or 60, were raised in a time where institutions were prevalent. An institution of a workplace, a business. You go and you're part of a business. Institution of going to a school, not just remote learning. You go to a school. Institutions of faith communities, tabernacles, synagogues, churches. People showed up, older adults. So those of us that are older have a tendency and a behavior and a pattern of being part of an institution, part of a community, part of an identity that is a group identity. Younger people, again, I would suspect under the age of 50, and especially youngers who went through the pandemic and remote learning, may lack that identity. And if you lack an identity, then you may not affiliate with a group. And if you aren't part of a group, then you may be socially isolated and then alone and feel lonely. I think back about what's going on with Extension, and our community vitality work is really important because when we think about community, our community vitality specialists and agents are building community identities out across the state. They're doing assessments in how smaller towns can actually create an identity. But then also location of places, the parks in the towns, or when are meetings held? Can people go to a town hall meeting? It's that identity of community that is really important. And community vitality is part of that.
Part of it is having a place for people to gather, but then it's also having something for them to do, right?
Absolutely. And in this light of social isolation and loneliness does lead to some really serious health issues. Many of our extension offices are doing physical activity promotion, stay strong, stay healthy. I know I'm partial to our cardiovascular and hypertension work, and that's done in community now too. We've just finished some pilots of worksite wellness around hypertension, and we're getting some good data results about people felt more comfortable talking about their hypertension when they were in a group and that they had social support. Well, gosh, those results go right lockstep with what the Pew study found, that if we feel less lonely and if we know we are more socially connected, our overall health will improve.
So when we talk about lonely, are we thinking that this is something that goes on for a very extended period of time, or can it just be something where if we can talk to somebody once or twice a week, or we do something once or twice a week, that will help?
Loneliness, according to what the study is that actual emotion, the psychological effect of understanding that I'm disconnected and then feeling some discomfort about that. Over time, if that persists 6 to 8 weeks persistently, then the person may be feeling depressed. And if depression is what's happening, then yes, definitely the person needs to have a provider who could support them and investigate, has this feeling of loneliness over 6 to 8 weeks persistently now led to being depressed. And that's a mental condition. It's a physical health condition. It can be treated. So yes, loneliness that's persistent, that affects our daily routines, meaning I'm not sleeping, I'm not eating, I am feeling really worried about my overall health and potential harm. If that continues at 6 to 8 weeks, then yeah, we need to reach out. But there is this malaise, I think, that maybe our society is going through about not knowing that being lonely is not typical. And that's where I worry about our younger people, and younger like in teenage years. If people are persistently socially isolated, and then this that's the way life is, then we need to reach out. We need to have community events. We need to have people who have an opportunity to join together, provide those kinds of social connections, invite your friend, invite the neighbor, invite your colleague that you know is stuck in the house doing video games. Go out, be part of community, and the overall health effects will be following.
That social interaction, very important. There is some, I guess, according to the Pew Research survey, though, there is some value in texting, video chatting, doing things like that. It's not the same, but it does, for some people, kind of fill that gap.
Yes. And you had just shared, for people over the age of 50 or 60, 65, we were not reared at that time. We didn't really have texting to connect with others. But for the younger people who are familiar with that, that still provides that social connection. And that's the difference between social connection and loneliness. If the person is socially connected, they have an identity, they have a group that they affiliate with, then they're less likely to feel emotionally lonely. If we feel emotionally lonely, then that's when the stress hormones, the inflammation, some of those questionable behaviors can follow and become an issue. But if the person is socially connected and they understand that that's their connection, then they're less likely to be less healthy. They're probably doing fairly well. I hate to think about if we slice that off because of a thunderstorm, we don't have electricity. Will the person be socially connected? Well, yeah, they probably will still be able to be connected to their friendship groups. But it's that loneliness. If it's persistent, that's where we have some problems with our health.
I think we are starting to see a shift, though, in the mentality of some people in terms of mental health professionals, because that was one of the things that people mentioned was one of their supports was a mental health professional.
Yes. And speaking of, the online telehealth, access to mental health professionals, behavioral health professionals is fairly convenient compared to what it used to be when you only had one person in a town that only had office hours. In our rural frontier areas, that is still a dilemma. In Kansas, we do not have enough access to telehealth and especially behavioral health. But it is becoming more and more customary, maybe even more comfortable, to talk about our therapists, that we're getting some social support as well as some really good mental health help from professionals. And that, in the Pew study, that is one of the array of social connections. We have access to professionals who can help us get over some of those feelings or experiences that are problematic and maybe don't have to see us after that. So we all need to be cognizant of when we need to reach out, how to do that, and how to help people do that, and then understanding that if loneliness becomes the issue too, then that's where we need to all help each other and really find some support.
That's Elaine Johannes, the Kansas Health Foundation's Distinguished Professor of Community Health at Kansas State University. K-State Research and Extension offers a variety of programs that connect people with their community. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.